Am I in? Hi everyone. Oh my God. Oh wow. Yeah, so we're finally live after a bit of a meander. Welcome to Wesley Guild Essay. I am my own host. I just want to see if people are logging in. All right, good. People are in, or one person is in at the very least. So I'll thank you, sister, who introduced me very well. I'd hoped to do a split screen of my presentation, but I think that won't necessarily be possible. But what I'm going to do, I'm going to talk about cancer. And for those of you who may not know, we are in Breast Cancer Awareness Month. So I just want to perhaps highlight some main issues around female cancers. So we're going to talk about breast cancer. We are going to talk about ovarian cancer. We're going to talk about uterine cancer. Just the main cancers basically that affect females. So if you'll just bear with me 1 second, I just want to check something. Okay, good. Now I just want to see if, all right, let's see. Oh, just bear with me 1 second, I just want to check something. Okay, good. Now I just want to see if, all right. Okay, so basically, what is female cancers? So as I said, we are in Breast Cancer Awareness Month, and so we're gonna focus mostly on breast cancer. So what is cancer? And so organs and tissues are made up of cells, as you may or may not know, if you've done biology. And in healthy tissues, these cells all the time are dying and repairing and getting replaced all the time. So what happens with old age basically is that the cells in your body are unable to replace themselves in an efficient manner, and they start making mistakes or errors. And as you get older, those errors may change into what we call a cancer. So a cancer is really a collection of cells that are not normal, that grow within the body. And when they grow, they invade other cells and they invade other tissues. So for instance, if it's a cancer that's from the breast, it grows in the breast, but then it goes and invades. It can go into the chest, it can go into the lungs, it can go into the stomach. So it's really a cancer that is basically that invades other tissues. In a nutshell, I'd hoped to be able to share the slides, but I think for technical issues, I won't be able to. But basically, there's a very nice slide that basically showed how you can go from one cell, a normal cell, and then depending on changes in the genetics, which we'll talk about later on, when we talk about risk factors, those cells can then change into a malignant type of cell. And so malignancy is basically another word for cancer. And as I said again, cancer cells can spread. So they move basically from a site that is different and can spread into the bone, can spread into other tissues. And that's basically how cancer kills you. So depending on the type of cancer, it sort of spreads and kills all other normal cells around it. And what it does then, it then kills the cells that help you to live. So it can spread into the liver, and then you can get a liver failure. It can spread into the brain, and you can get a stroke. It can spread into the bloodstream, and you can get bleeding. You can get clots. So there's many sort of complications of cancer. So I think as a sort of black community, we're not really well versed in terms of cancer and how it works. So I think the purpose of this presentation is just to I think, give us a taste in terms of what cancer is and how we can better equip ourselves to knowing. So as I said, today I'm really focusing almost entirely on the female cancers. But you'll see when you talk about breast cancer specifically, men can get breast cancer, and so we also need to be aware of that as men in terms of taking care of ourselves. So, just in terms of a background, it says women have a 1 in 7 chance of getting breast cancer in their lifetime. So it means if there's 7 of us in guild, if we're friends and we're women, then one of us has a chance of getting it in their lifetime. And the chance of dying from breast cancer is 1 in 33. So it's a very prevalent disease. The rates are going down on a worldwide perspective, but I think in terms of South Africa and Africa, we're finding more and more Black people are getting breast cancer and are getting diagnosed with breast cancer. So I mean, from our grandparents and that sort of generation, we didn't know about these things, and we didn't have people getting breast cancers, but it's becoming quite prevalent in our generation. So, again, in terms of socioeconomic background, so women who have more access to education, who have access to medical aid, who have access to screening, which we'll talk to a bit later on, have a better chance in terms of breast cancer, and in terms of getting their diagnosis earlier, and in terms of getting better treatment and surviving better. Um, what are the risk factors in terms of breast cancer? So a risk factor basically means, what are the things that you are doing in your life, whether it's food, whether it's activity, can give you a higher chance of getting breast cancer. So I think the most significant risk factor for breast cancer is your gender. So women, obviously, 98% of breast cancers are in females. So women are the biggest risk factor, and also age. So the older the woman grows, the bigger the chance of her getting breast cancer. Also, they talk about having fertility treatments. So if you've for instance you've gone for fertility treatments, it does pose a minimal risk of getting breast cancer. Not really relevant, I think, for us younger people, but use of hormones. So women who are menopausal will use hormones to basically decrease the menopause symptoms, and so that also doesn't really increase breast cancer risk. So in terms of the signs, so the most important one is a lump is felt in the breast, right? That's the most important sign. And when we talk later on about self-examination, the most important thing a woman should look out for is a lump in the breast. Then another one is an inverted nipple. So, as you know, the nipple is everted, so it goes outwards. So if the nipple starts going inwards, I think one should be worried about that. If there's a discharge from the nipple, so whether it's a whitish discharge or it's like a creamy discharge, or even a bloody discharge, one should be worried and have it checked out. If there's any pain in the breast, pain in the breast, pain in the nipple, that's also something that one should look out for. If one notices any sores on the nipple, any sores on the breast, any skin changes on the breast, also one should be careful of that. And then lymph nodes. So if you feel basically under your armpit, and if you feel around your neck over here, if you feel like a marble shaped ball, as part of your examination. So if you're feeling little balls are up above your clavicle or below your clavicle, or even in the armpit, so that's also something that you should be aware of. So we'll talk a bit more when we get to breast self-examination. So when we're talking again about the signs and symptoms, There can be quite a change in terms of the appearance of the skin, as I said. You can also have enlargement of one breast, even though that's not common. There may be discoloration of the breast. It may look red. In lighter people, it may look purple. Um, and also there's a phenomenon called pudorage in medicine. So the skin of the breast looks like an orange. So you know how an orange looks? It's got like little indentations in it. So you have that. It's a very, very strong sign for breast cancer. So I think those are the main ones to look out for. Um, and then I think the most important thing for me is in terms of screening. So there's guidelines in terms of how to prevent breast cancer and how to pick up. So if the sooner we pick up that you've got breast cancer, the sooner we're able to treat you, the better your outcome. So I mean, if you pick it up very small, very early, you can usually have a very small operation to remove the lump, and it's better for you. You live longer, as opposed to when you present with a very big tumor in the breast. It becomes much more difficult to treat. You don't live as long, and you have lots more pain, and it's much more difficult. So, so in terms of us, I think for us, for young people in our 20s and 30s, you should at least be going to your doctor once every 3 years to examine your breast. Um, and they may or may not want to do a scan of the breast to see if there's any changes in the breast, right? But I think the expectation is that for women, one should be doing regular breast examinations. So, when one is out of the shower and one is in a relaxed state, so I'm going to try and demonstrate it. So you put your hand behind your head like that, and you sort of feel, around where the breast. I don't obviously have a breast, but you feel in around your breast, and you feel for any lumps, you feel for any pain, you feel for any changes. You look at the breast, and again, as I said, you feel underneath the armpit here if there's any balls that you can feel, if something feels painful, if there's something different. So the most important thing in terms of the breast examination is that you need to know you're normal. So that when something changes, when something is painful, when something is different, you can pick it up quite readily, right? And then in older ladies, you need to have a test called a mammogram that you do, and that again it scans the breast tissue and it allows you to be able to pick up cancer quite early. So I think for me the most important thing about breast cancer is that you need to examine yourself as a female often, and you need to know how your breasts are, how your breasts feel, and know your size, and so that if there is a lump or if there's any changes, then you can pick it up quite early, and you don't sort of delay treatment. So I'm not going to go into too much in terms of the treatment. Maybe someone will ask it later on. But I'm not going to go into much detail about the treatment. But the surgery where you cut it out, essentially, there's chemotherapy, which basically means we give you drugs, and there's radiation, which is basically like being under an X-ray, which basically burns and shrinks the tumor, right? Um, then the other type of cancer, I'm going to try and be quick, is ovarian cancer. So ovarian cancer occurs in the ovaries, which is basically where the eggs, for women who are at pregnancy age, that's where basically the ovarian cancer occurs. So it's very common in the world. I think it's the fourth most common female cancer and has a lot of deaths as well. And the problem with ovarian cancer, because it happens inside the stomach or the abdomen, it's very hard for us to pick it up early. Um, there's not really much science, and I think that in terms of symptoms, the only thing you'll feel maybe is a bit of pain later on when the cancer is quite progressed. But generally, it doesn't have much symptoms. So in terms of risk factors, as you spoke earlier on, risk factors is certain activities or certain things in your life that give you an increased chance of getting the cancer. So in terms of the risk factors, age. So older ladies get ovarian cancers between 50 and 70. It's more common in ladies who've not had any children, or ladies who've had children quite late. So they say late age at first birth, right? Also, it's quite common in ladies that have had a very early, started periods very early and menopause very late. Um, Also, there needs to be a family history. So, if, for instance, your mother, your aunt, your grandmother had breast cancer or ovarian cancer or cancer of the bowel, it increases your chances of getting ovarian cancer. So, and then in terms of the protective factors, so I think these are the things that can help you prevent getting breast cancer. So, women that have children quite early, women that are on contraception. So it seems like the hormones in contraception actually protect you from getting ovarian cancer. Also, physical activity, so not being obese and not being large. And also breastfeeding apparently has a great effect, as well as your diet. So, as I said earlier on, there's not much in terms of symptoms of ovarian cancer. You can have poor appetite, you can have indigestion, you can have nausea, you can have feeling of being bloated, swollen abdomen, or pain in the abdomen generally. Um, and so when if you do feel these very vague symptoms, I think for me the most important thing is that you need to be aware of it and you need to go see your doctor as soon as possible. And then they can run the tests and do the scans and actually see if they can pick up if there's something, right? Then I think the last one I'm going to talk to is cervical cancer. So this one is very important for us in South Africa. And so the cervix is basically the mouth of the womb. So you have the vagina and then you have the womb there. So the cervix is basically a little organ at the mouth of the womb. The reason cervical cancer is very important for us in South Africa, we've got a very high rate of a virus called human papillomavirus. So for those of you who go to the clinic regularly, you'll have been offered a vaccine against HPV. And so we found that this kind of cancer, if you take the HPV vaccine, it can actually decrease your chances of getting the virus and decrease your chance of getting the actual cancer. So in terms of this cervical cancer, the most important risk factor is smoking. So it increases your risk factor very highly, and of course, and then the human papillomavirus. And how you get human papillomavirus, you get it from having unprotected sex at a very young age, and then you get the virus basically infesting over there in the cervix, and as you get older, then it can make the cells change into cancer cells. So in terms of the symptoms, what are the symptoms of cervical cancer? So abnormal vaginal bleeding. You can have, so your periods become basically very abnormal, very long, very heavy periods. And also you can have bleeding in between periods. You can also have bleeding during and after sexual intercourse. And there's another one called postmenopausal bleeding, which basically means bleeding when you are in menopause, which means you should not be having any periods. Um, and then also, you can also have a vaginal discharge with a very ugly odor. And then there's also pain during sex. So you should actually not be having, ladies, it should not be painful to have sexual intercourse. So if sex is proving painful for you, I think it's something that you need to have a discussion with your doctor and see if there's nothing that they can find in terms of the screening. So again, I think in terms of cervical cancer, the most important message I can give to the ladies is that you must have a pap smear. So they say between the ages of 25 to 44, you must have it um, every 5 years. Um, and then as you get older, your pap smears should be much more regular. So I think between the age of 45 and 60, you should be having pap smears every year, pretty much. And that basically picks up if there's any cancer cells in the cervix. And then I think the last thing I really want to talk about is this vaccine. So currently in the public sector and clinics, they're providing this HPV vaccine for free. And they only give it, how unfortunately or fortunately, um, to girls who are quite young who haven't started engaging in sexual intercourse. So if you've already engaged in sexual intercourse, there's a very high chance that you've been infected with this HPV virus. So the vaccine won't help. But for young girls, they say between the age of 11 to 13, we haven't engaged in sexual intercourse. So you can even go up to the age of 18. Just make sure they're not engaged in sexual intercourse. They can get this vaccine. It's free at the clinic, and it actually protects you against cervical cancer. So I think for me, that's my parting shot to say let's examine ourselves. Let's know our bodies. If something feels weird, if something feels painful, then go see your doctor sooner rather than later. And I think also, ask your parents, find out if there's been a history of cancer. I think in our Black context, people tend to like to hide these things and not talk about them. But if you ask, then you can actually know about something, and then you can be aware of it, so that you can prevent yourselves from getting very sick and dying. So I mean, it's a very broad overview. And then I'm going to take questions, so it's going to be really difficult for me. But I'm going to take questions and comments because I'm the one, so I don't have a co-host. So just bear with me quickly. I'm just going to go up and see if I've missed anything. Don't think I have. So I think there was a comment from Umfunsunyembe, and I just need to get to it. And he says, I wish I could listen further, but this makes me very emotional. And I think it's a very emotional topic. Many people have lost sisters and mothers and aunts to these female cancers. And I think for us, the most important thing is that we're aware of them, and we can actually try and prevent ourselves from getting them, or at least try and get ourselves treated quite early on. Okay. So I don't know if I've missed any questions. Let me just go up. So if you do have any questions, just please just type it at the bottom. Let's just see. Okay. All right. So yeah, I know it's very strange moderating for yourself. So I'm not seeing any questions. I'm seeing messages of support. So I'm not seeing any questions or any comments on the Facebook page. So I am going towards the end. I think we'll probably do a much nicer session next time. Okay, now I'm seeing a question. So there's one from Ufumani. It says, does birth control or contraception contribute to anything cancerous? So I think birth control is actually helpful in terms of cancer. So especially stuff like endometrial cancer, it's been found to actually decrease your chance of getting cancer. And I think that's part of it is just because it's hormones. It's your own natural female hormones. So birth control has actually been found to decrease your chances of getting cancer. Okay. Let's see. Oh, all right. And okay. So someone is asking if I'm not going to touch on testicular cancer. So I think we're going to have a separate session for male cancers. But I think testicular cancer is a whole other different kettle of fish that I don't want to go into today. Sister Siboniwe says, what are the chances of getting sick again after chemo? So it depends on a few factors. So it depends on the cancer, and it depends on how early we get it. So ideally, if we catch the cancer very early and we're able to treat you quite well the first time and remove as much cancer as possible and give you chemo, the chances of getting sick again after chemo are much, much low. But again, if you get cancer quite late and your then your chances of getting sick after chemo are much, much higher. So I think the most important thing for us is that you want to catch it early, you want to treat it well so that it doesn't recur. I spoke a little bit earlier on about male breast cancer, and I think I want to just sort of reiterate again. So men can get breast cancer. It's very, very low chances. But again, men, when they get breast cancer, they get it quite late. So they get it much later than their women counterparts. So I think for men, it's from the age of about 40 to about 70. Very similar signs and symptoms to women. So generally, there'll be a lump, in the sort of chest area or the breast area. There'll be a lump, there'll be pain, there may be changes to the skin, um, and then there may or may not be lymph nodes under the armpits and in the clavicle. So male breast cancer is there. It's much more difficult to treat because they generally present very late. So I think for us, it's just to be aware. Just because you're a man, if you're feeling a lump, in your chest and it just feels weird and it hasn't been there, I think for me the most important thing is that go to your doctor, get it checked out, because men do actually get breast cancer. So yeah, let me just see if there's any more questions or comments. Okay. Again, so Brother Tokelo is asking again on, I think, testicular cancer. So I think we'll touch on the male cancers next time, and I think we'll have a bit more time to be able to engage better. I think, yeah. So there's a new question. Okay, gentlemen, prostate cancer again. So today, I think to those who tuned in a bit late, because it's Breast Cancer Awareness Month, we're focusing on the female cancers. So prostate cancer, testicular cancer, all the male cancers. I think we'll talk about it in November. So November is basically the month that we dedicate to the male cancers. So I think let's give the ladies their chance today, um, and so let's leave the male cancers for now. Um, so yeah. Let's see if there's any more questions. Okay, guys. So we're literally okay. All right. So this is a very male-orientated question from Utogelo. He says, should one worry about gynecomastia? So gynecomastia is basically when men develop, breasts that look like women. So men don't have breasts in the traditional sense, but in terms of the pectorals, there are breast tissues. So when a man develops, breasts like, they become quite large, one should be quite concerned and one should go check it out, get it checked out by the doctor. I think that's all I'll say on gynecomastia. But when we talk about male cancers next month, if I'm invited again, then I think we'll go into a bit of detail in terms of men and examination and self-examination and that sort of thing. So I don't think I think we're quite clear in terms of the female cancers. So I'm going to close the session now. It's been very business as usual. And I think we had some technical issues with our Zoom and our Wi-Fi. But I think if there's any other burning questions, maybe just hold on to them. And then when we in November, when we're discussing some of the male cancers, we'll perhaps just close off with some of the questions from the female cancers. So I think if there's nothing else, I'll end the session here. And I'll thank the Wesikill team for the opportunity. Thank you.